We are going to study about the rotor incomplete sentence blank, also known as RISB, a psychological test designed to reveal underlying thoughts and emotions through sentence completion. We'll cover introduction, test description, psychometrics, administration, interpretation, scoring, and advantages and disadvantages of the test. Rotor incomplete sentences blank (RISB) is a projective psychological test developed by Julian B. Rotor in 1950. This projective test was developed to assess an individual's personality, thoughts, and emotions through sentence completion. By analyzing the responses, psychologists can gain deeper insights into a person's inner experiences and emotional state. The RISB is a self-report test made up of 40 incomplete sentences, each only 1 or 2 words long. It has various versions tailored to different age groups, including school, college, and adult forms. The RISP test consists of 3 main sections: the ideation scale, the affect scale, and the social relationship scale. The ideation scale measures the subject's cognitive style and thought processes, while the affect scale assesses their emotional state and level of adjustment. Lastly, the social relationship scale evaluates the individual's interpersonal style and social. The average time to complete RISP test is around 20 minutes. There are no right or wrong answers, and the subjects are encouraged to be as honest and spontaneous as they can be. The test measures an overall index of adjustment. It can be used for screening, group comparisons, or research purposes. The test can be administered in either an individual or group setting. Also, the test is available in Urdu version. For any psychological test to be useful, it must be both reliable and valid. In terms of reliability, the RISB has demonstrated consistent results across different administrations over time, with test-retest correlations ranging from 0.70 to 0.80. As for validity, the test has been shown to accurately measure emotional adjustment, anxiety, and other psychological factors. However, some critics point out that subjective interpretations can influence both reliability and validity, making it essential for evaluators to be well trained. The RISP test is typically administered by psychologists or counselors in a clinical setting, though it can be used in research and educational contexts. The clinicians ask the subject to complete the following sentences to convey their actual feelings. Try to attempt all of them and make sure that you make a complete sentence. There are no further instructions except if necessary to encourage the subject to complete all the items. The test is straightforward, requiring participants to complete 40 sentences stems within about 20 to 30 minutes. No special preparation is required, making it an easy to administer tool for both the professional and the participant. Here is the sample of the RASP test, including the 40 questions the participant has to complete within 20 to 30 minutes. Scoring the RASP test involves evaluating responses for signs of emotional distress, conflict, or psychological issues. While the test offers structured guidelines, much of the scoring is subjective and depends on the clinician's interpretation. Each sentence is assigned a numerical weight from 0 to 6, with the total score being the sum of these values. Responses are rated on a 7-point scale, where 0 represents a very positive, well-adjusted response, and 6 represents a highly negative, maladjusted response. The cutoff score is 135. Scores below this are considered well-adjusted, while those above indicate a state of maladjustment. Scoring for the RASP test involves following specific guidelines. Omissions and incomplete sentences are not scored. If a response is longer than 10 words, an additional 1 point is added. Positive responses are denoted by P. P1, mild positive, we add 1 point for that. For example, I enjoy spending time with friends. P2, moderate positive, we add 1 point for that. And for P3, strong positive, we add 0 points. Neutral responses denoted by N, we give 3 points for that. For example, I have friends and I see them occasionally. Conflict responses are denoted by C. C1 indicates mild conflict, we give 4 points for that. C2 indicates moderate conflict and we give 5 points for that. Whereas C3, the severe conflict, we give 6 points for that. After the test is complete, the clinician will score the responses using a standardized scoring system which we have learned before. Interpreting the results of the RISB test requires careful consideration of individuals' emotional state and background. Responses to the incomplete sentences can reveal patterns such as recurring themes of insecurity, fear, or ambivalence about important life aspects. Clinicians use these patterns to better understand the individual's internal conflicts, emotional adjustment, and overall mental health. The scores are then used to generate a personality profile that can be used to understand the individual's strengths and weaknesses, coping mechanisms, and the areas of potential growth. The results are often incorporated into broader psychological evaluations or used to inform treatment strategies. One of the RISB test's main advantages is its simplicity and quick administrations. It provides a broad yet insightful look into a person's emotional state without the need for extensive resources. The test has a freedom of responses and the purpose of test has a disguise. It can be administered in groups and no special training is required for administrating this test. It can also become a part of a clinical interview and its method is flexible so it can develop a special purpose as well. However, a key disadvantage is its reliance on subjective interpretations which can vary between clinicians. It requires knowledge and general skill of personality analysis for interpretation, and it also cannot be machine schooled. When the subject is illiterate, disturbed, or uncooperative, material obtained might be insufficient. The interpretation of this test can be very time consuming, and we require a literate mind for this test. Despite these limitations, the test remains a valuable tool for psychological assessment, especially when used in conjunction with other methods.